In this video, here's what we'll cover. Why adult ADHD is suddenly big news. Australia lets GPS diagnose and treat ADHD. A sobering study on ADHD and lifespan beyond medication. A new cognitive training trial. The bottom line, and why assessment still matters. Have you ever wondered whether a lifetime of lost keys, missed deadlines, restlessness, and quiet overwhelm might add up to something with a name? For a long time, adults asking that question about ADHD faced long waits, high costs, and a lot of uncertainty. This week, a few developments crossed my desk that, read together, quietly changed the picture. So let me walk you through them, plainly and carefully. First, a word on how I approach news like this. I only draw from credible, primary sources, peer-reviewed journals, universities, and official health bodies, and I treat new research as emerging, not settled. A single study is interesting, but it rarely changes clinical practice on its own. With that in mind, here is what stood out. Let me start with why adult ADHD is suddenly everywhere. Demand for assessment has surged, wait lists have stretched to many months, and governments are now rethinking who is allowed to diagnose and treat it. Three things landed this week: a wave of Australian reforms, a sobering study about ADHD and lifespan, and a glimpse of where treatment research is heading. Taken together, they make one gentle point: getting adult ADHD right matters more than we used to think. The biggest story is that Australia is letting GPS diagnose and treat ADHD, state by state. For years, the path to an adult diagnosis here ran almost entirely through psychiatrists, often with long waits and high out-of-pocket costs. That is changing fast. Across the past 2 years, states and territories have begun authorising suitably trained GPS to take on more of ADHD care. Queensland moved first and furthest, letting specialist GPS start and manage ADHD medicines for adults from late last year. New South Wales now allows trained GPS to continue stable prescriptions, with a further pathway for GPS to train in assessment and diagnosis. And South Australia, Tasmania, Western Australia, Victoria, and the ACT are each rolling out their own training-based pathways, with Victoria training an initial group of about 150 GPS. The goal here is sensible and humane: shorter waits, lower costs, and care closer to home for a condition that affects a large number of adults. But I want to be careful with one thing: faster must not mean looser. ADHD is diagnosed from a person's history and how they function, not from a single test. And its symptoms overlap with anxiety, depression, trauma, sleep problems, and autism. These reforms mostly concern medication. They do not replace the value of a thorough diagnostic workup, especially where the picture is complex or a diagnosis has been uncertain for years. The second item is the kind I report slowly, because the headline can frighten people unnecessarily. It is a major study, published in the British Journal of Psychiatry, that looked at ADHD and life expectancy. Researchers used UK primary care records from nearly 800 general practices to compare adults diagnosed with ADHD against matched peers. They found a real gap. On average, about 6.8 years shorter for men, and 8.6 years shorter for women who had a diagnosis. Now, please read the author's own words before the headline. They stress that this shortened lifespan is, in their words, unlikely to be because of ADHD itself. Instead, it reflects modifiable factors, things like smoking, and unmet mental and physical health needs. In other words, it points to gaps in care and support, not to ADHD being a death sentence. This was a study of diagnosed adults who may have had more severe or complex difficulties, so it is not a forecast for any one person. And the drivers it names: untreated symptoms, co-occurring depression and anxiety, accidents, gaps in healthcare, are things we can actually do something about. That makes the takeaway hopeful, not fatalistic. Timely diagnosis, treatment, and support are part of looking after long-term health. The third item looks at where treatment is heading, and it is a reminder to keep our enthusiasm honest. Many adults with ADHD cannot take stimulant medication, do not respond fully to it, or simply want to build skills alongside it. That has driven real interest in non-drug options. This week, Researchers published a trial protocol for a study that will test whether 12 weeks of an AI-based cognitive training program improves attention in adults with ADHD. Notice that word, protocol. This describes a study that is about to run. It has no results yet, so I share it not as proof that the app works, but as a healthy sign that non-drug supports are being tested properly. In the meantime, the non-medication help that is well established is practical and human: structure, routines, and strategies for attention, organization, and the emotional side of ADHD. So what is the bottom line? Read together. These developments tell one coherent story. Access is improving, which is a real and welcome change. ADHD deserves to be taken seriously for long-term health, precisely because those risks are largely modifiable. Treatment is broader than a prescription, and a careful assessment still matters, because faster access is only a gain if the diagnosis underneath it is sound. If you have wondered whether ADHD might explain a lifetime of overwhelm, you do not have to figure it out alone. Our team at Potentialz Unlimited in Bella Vista offers comprehensive, evidence-based ADHD assessment and support for adults. You can read the full roundup, or get in touch, using the links in the description below. Before you go, here's a quick recap of what we covered. Why adult ADHD is suddenly big news. Australia lets GPS diagnose and treat ADHD. A sobering study on ADHD and lifespan beyond medication. A new cognitive training trial. The bottom line, and why assessment still matters.